HESI A2 Axial Skeleton Questions. Question 1. Impairment of which bone would most directly prevent the following function? Forms the cheek prominence and part of the orbit? Option A, carpals. Option B, parietal bone. Option C, zygomatic bone. Option D, frontal bone. The correct answer is option C, zygomatic bone. A key clue is that this bone articulates with the temporal bone in the zygomatic arch. It also forms the cheek prominence and part of the orbit. That combination is central to building the lateral face. Question 2. Which option identifies the bone associated with protecting mediastinal organs in both clues? It forms the anterior midline of the thoracic cage, and it includes the manubrium, body, and xiphoid process. Option A, sternum. Option B, ischium. Option C, tarsals. Option D, phalanges of the hand. The correct answer is option A, sternum. The function described is that this bone forms the anterior midline of the thoracic cage. A second identifying feature is that it includes the manubrium, body, and xiphoid process. Together, the two clues explain the role in protecting mediastinal organs. Question 3. Which option identifies the bone with this feature? It also contributes to the hard palate and orbit? Option A, ischium. Option B, sacrum. Option C, metatarsals. Option D, maxilla. The correct answer is option D, maxilla. This bone participates in building the facial skeleton. It forms the upper jaw and supports upper teeth, and it also contributes to the hard palate and orbit. Those details distinguish the tested concept from related choices. Stressed about your GED? We can take GED for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which option identifies the bone most important for forming the lower back because it supports much of the body weight? Option A, lumbar vertebra. Option B, pubis. Option C, humerus. Option D, atlas. The correct answer is option A, lumbar vertebra. A key clue is that this bone has a large body and sturdy processes. It also supports much of the body weight. That combination is central to forming the lower back. Question 5. Which option identifies the bone with this feature? It contains a cribriform plate for olfactory nerve fibers. Option A, ethmoid bone. Option B, tarsals. Option C, thoracic vertebra. Option D, coccyx. The correct answer is option A, ethmoid bone. This bone participates in supporting smell pathways. It contributes to the nasal cavity, orbit, and cranial floor, and it contains a cribriform plate for olfactory nerve fibers. Those details distinguish the tested concept from related choices. Question 6. Which option identifies the bone best matching this description? It is the first cervical vertebra and lacks a typical body, and it supports the skull and permits nodding. Option A, sacrum. Option B, mandible. Option C, atlas. Option D, carpals. The correct answer is option C, atlas. For connecting the head to the neck, this bone supports the skull and permits nodding. It can also be recognized because it is the first cervical vertebra and lacks a typical body. The remaining choices have different primary functions or locations. Question 7. Which option identifies the bone associated with forming the upper vertebral column in both clues? It supports the neck and allows a wide range of motion, and it typically contains transverse foramina. Option A, pubis. Option B, tarsals. Option C, cervical vertebra. Option D, fibula. The correct answer is option C, cervical vertebra. The function described is that this bone supports the neck and allows a wide range of motion. A second identifying feature is that it typically contains transverse foramina. Together, the two clues explain the role in forming the upper vertebral column. Question 8. A physiology item gives two clues. It attaches directly to the sternum through its own costal cartilage, and it includes the first 7 pairs. Which option identifies the bone? Option A, true rib. Option B, carpals. Option C, femur. Option D, patella. The correct answer is option A, true rib. The role tested here involves forming the thoracic cage. This bone attaches directly to the sternum through its own costal cartilage. It can also be identified because it includes the first 7 pairs. Are you looking for Get Actual questions? Visit our website pokerexams.com to access GED study guide with actual questions and answers. Scan the QR code or click the link in the description to get GED answer key today. Question 9. Which option identifies the bone most important for forming the lower thoracic cage because it attaches indirectly or not at all to the sternum? Option A, zygomatic bone. Option B, false rib. Option C, true rib. Option D, coccyx. The correct answer is option B, false rib. A key clue is that this bone includes rib pairs 8 through 12. It also attaches indirectly or not at all to the sternum. That combination is central to forming the lower thoracic cage. Question 10. Which option identifies the bone with this feature? It includes the last two rib pairs. Option A, hyoid bone. Option B, a floating rib. Option C, sacrum. Option D, tarsals. The correct answer is option B, floating rib. This bone participates in protecting posterior upper minus abdominal structures. It has no anterior attachment to the sternum, and it includes the last two rib pairs. Those details distinguish the tested concept from related choices. Question 11. A student is reviewing a concept involved in forming the posterior thoracic cage. Which option identifies the bone with this function, articulates with ribs? Option A, coxal bone. Option B, hyoid bone. Option C, lumbar vertebra. Option D, thoracic vertebra. The correct answer is option D, thoracic vertebra. The role tested here involves forming the posterior thoracic cage. This bone articulates with ribs. It can also be identified because it typically has long downward minus pointing spinous processes. Question 12. Impairment of which bone would most directly prevent the following function, forms part of the lateral skull and houses hearing structures? Option A, temporal bone. Option B, pubis. Option C, tarsals. Option D, fibula. The correct answer is option A, temporal bone. A key clue is that this bone contains the mandibular fossa and mastoid process. It also forms part of the lateral skull and houses hearing structures. That combination is central to supporting the ear and jaw joint. Question 13. Which option identifies the bone most directly associated with protecting the frontal lobes and this function, forms the forehead and part of the orbit roof? Option A, ulna. Option B, temporal bone. Option C, fibula. Option D, frontal bone. The correct answer is option D, frontal bone. This bone participates in protecting the frontal lobes. It forms the forehead and part of the orbit roof, and it is an unpaired cranial bone at the anterior skull. Those details distinguish the tested concept from related choices. Question 14. Which option identifies the bone associated with protecting the brain in both clues? It forms much of the superior and lateral skull, and it is one of a paired set joined at the sagittal suture. Option A, temporal bone. Option B, parietal bone. Option C, mandible. Option D, tibia. The correct answer is option B, parietal bone. The function described is that this bone forms much of the superior and lateral skull. A second identifying feature is that it is one of a paired set joined at the sagittal suture. Together, the two clues explain the role in protecting the brain. Question 15. A learner connects the clues, supports the tongue and provides muscle attachment and does not directly articulate with another bone. Which option best matches both clues? Option A, false rib. Option B, ilium. Option C, fibula. Option D, hyoid bone. The correct answer is option D, hyoid bone. The function described is that this bone supports the tongue and provides muscle attachment. A second identifying feature is that it does not directly articulate with another bone. Together, the two clues explain the role in assisting swallowing and speech. Question 16. Which option identifies the bone best matching this description? It is the second cervical vertebra and bears the dens, and it permits rotation of the head. Option A, axis. Option B, calcaneus. Option C, humerus. Option D, ethmoid bone. The correct answer is option A, axis. For allowing side minus to minus side head movement, this bone permits rotation of the head. It can also be recognized because it is the second cervical vertebra and bears the dens. The remaining choices have different primary functions or locations. Question 17. Which option identifies the bone associated with supporting chewing and speech in both clues? It forms the lower jaw and supports lower teeth, and it is the only freely movable bone of the skull. Option A, coxal bone. Option B, patella. Option C, mandible. Option D, carpals. The correct answer is option C, mandible. The function described is that this bone forms the lower jaw and supports lower teeth. A second identifying feature is that it is the only freely movable bone of the skull. Together, the two clues explain the role in supporting chewing and speech. Question 18. Impairment of which bone would most directly prevent the following function? Forms the posterior skull and surrounds the foramen magnum? Option A, ulna. Option B, occipital bone. Option C, dilium. Option D, a radius. The correct answer is option B, occipital bone. A key clue is that this bone articulates with the first cervical vertebra. It also forms the posterior skull and surrounds the foramen magnum. That combination is central to connecting the skull to the vertebral column.
Stressed about your NA-CCMA? We can take NA-CCMA for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. Which option identifies the bone that forms a central portion of the cranial floor? Option A, tibia. Option B, sphenoid bone. Option C, clavicle. Option D, coxal bone. The correct answer is option B, sphenoid bone. This bone forms a central portion of the cranial floor. It contains the sella turcica that supports the pituitary gland. These linked features explain the role in linking several skull bones. Question 20. Which option identifies the bone that transfers upper minus body weight to the pelvis? Option A, calcaneus. Option B, occipital bone. Option C, false rib. Option D, sacrum. The correct answer is option D, sacrum. This bone transfers upper minus body weight to the pelvis. It consists of fused vertebrae. These linked features explain the role in forming the posterior pelvic wall. Question 21. Which option identifies the bone with this feature? It consists of small fused vertebral remnants. Option A, radius. Option B, coccyx. Option C, talus. Option D, carpals. The correct answer is option B, coccyx. This bone participates in forming the terminal vertebral column. It provides attachment for pelvic minus floor structures, and it consists of small fused vertebral remnants. Those details distinguish the tested concept from related choices. Question 22. Which option identifies the bone most directly associated with forming the thoracic cage in this function? Attaches directly to the sternum through its own costal cartilage? Option A, true rib. Option B, carpals. Option C, femur. Option D, patella. The correct answer is option A, true rib. This bone participates in forming the thoracic cage. It attaches directly to the sternum through its own costal cartilage, and it includes the first 7 pairs. Those details distinguish the tested concept from related choices. Question 23. A review item describes a bone that is the first cervical vertebra and lacks a typical body. Which option identifies it? Option A, sacrum. Option B, mandible. Option C, carpals. Option D, atlas. The correct answer is option D, atlas. For connecting the head to the neck, this bone supports the skull and permits nodding. It can also be recognized because it is the first cervical vertebra and lacks a typical body. The remaining choices have different primary functions or locations. Question 24. A student is reviewing a concept involved in supporting the ear and jaw joint. Which option identifies the bone with this function, forms part of the lateral skull and houses hearing structures? Option A, pubis. Option B, tarsals. Option C, temporal bone. Option D, fibula. The correct answer is option C, temporal bone. The role tested here involves supporting the ear and jaw joint. This bone forms part of the lateral skull and houses hearing structures. It can also be identified because it contains the mandibular fossa and mastoid process. Question 25. Which option identifies the bone whose key function is, forms much of the superior and lateral skull? Option A, temporal bone. Option B, mandible. Option C, parietal bone. Option D, tibia. The correct answer is option C, parietal bone. This bone forms much of the superior and lateral skull. It is one of a paired set joined at the sagittal suture. These linked features explain the role in protecting the brain.